It's so critical for me to understand what's important to them, what's hard for them, what are they working with that is challenging, and thinking about from an HR perspective, what is it that I can influence with regards to their talent to help solve those business problems, and not just be thinking about it, well, we should do performance or we should give benefits. Those are important elements, but why? Why should we do those things? We do those things to help drive the organization or help make things better in the organization we do them.
Hello and welcome to Advancing Leadership Beyond the Bedside podcast. I'm your host, Mike Duggan, and if you're a leader or an aspiring leader in the healthcare industry, you've come to the right place, and you're going to love today's episode because we're talking with Jen Law, Chief Human Resources Officer of Vail Health. Jen's career in human resources has spanned more than 20 years in industries from hospitality to healthcare. She's a strategic leader and member of the executive team aligning talent strategy with the organizational strategy. Today, we're going to hear a little about her career journey and some tips on how others can reach their career aspirations. We'll also be discussing a workforce well-being project they've been hard at work on. Jen, welcome to Advancing Leadership Beyond the Bedside.
Thanks, Mike. I'm excited to be here and good to see you.
Yeah, it's nice to see you as well. Thank you for joining us on the show. Let's start by talking a little bit about your career. So what can you tell us about your journey to become a CHRO and any key experiences or decisions that helped you advance your career?
Yeah, sure. Of course. As you kind of mentioned in the intro, my background hasn't always been in healthcare. So I know many people in healthcare really grew up in this space, and I've come to it a little bit later in my career. However, I have been in human resources for the majority of my career. One of the reasons that I was so excited about this opportunity is that when I was in high school, I volunteered at my local hospital, and I was for a long time thought maybe I might want to be a physician, but I didn't like chemistry very much. So I decided I was much better at people. I majored in psychology and communication and thought that that was a better fit. But that's really kind of how I got my interest a little bit in healthcare. I was actually a candy striper. If anybody is old enough to know that term, I literally wore a red and white striped dress to go to volunteer. And, it was a great experience. I loved being in that environment. They've always been really curious about and so passionate about being able to serve other people, especially when they're not maybe in their best space. But also, I'm also very interested in healthcare for the future looking, like how do we help people be more preventative in their care so that we're not just providing sick care, but we're really providing health care. And that was one thing that really drew me to Vail Health, is that knowing that they're serving our community and not just providing sick care, but also looking to really provide future health care. A few things that maybe kind of to your other question about not only just how did I get here, but maybe some decisions that happened along the way that I've learned is that I think it is important to be really curious. I think that's one thing that's helped me to be successful in any organization that I've ever worked in. I think building relationships and by being really curious, asking a lot of questions, I find that people in operations love to tell you about what they do and how they do it. It really just kind of opens the door. Any place I've ever worked, I'm always like, can I come and shadow you? And I ask a lot of questions about, how are you doing that? Why do you do that? How does that work? And not only does it help build that relationship, but I learn a lot about how what we do in human resources might influence the operation, as well as just building that relationship and really having an understanding of what's happening.
Oh, that's wonderful. And such a truth, I think, across all industries. I find that the best recruiters on our team are often the ones that also have a lot of questions and have that curiosity, right? And I, of course, love that viewpoint as far as healthcare. It's one of the reasons I am passionate about working in healthcare myself, is to try to make a difference and help create that future. As far as, people that are aspiring to, move their way up the ladder, what kind of advice would you have for them that people should either take into consideration or actively seek out while they look to advance their career?
Yep. I think it's always really important to obviously be really good at what you're doing in the moment. And I also think it's important to understand your strengths and how you're leveraging your strengths. And also equally as important to understand where you don't have strengths and where you have a lot of opportunities, and to seek people out that are different than you, so that where they have strengths that are opposite of you, and be open to learning from them or surrounding, yourself with those people who who do maybe think a little bit differently than you. I think part of my success has been finding partners in different parts of the business. So it's as an HR leader, right? I have kind of one lens around people, but it's so important that I understand the finances. So I always work really closely with my finance partners to understand what drives the organization. How do we make money? Where do we lose money? How does the business parts come together? And then I already kind of mentioned the operations leaders. It's so critical for me to understand what's important to them, what's hard for them, what are they working with that is challenging, and thinking about from an HR perspective, what is it that I can influence with regards to their talent to help solve those business problems, and not just be thinking about it, well, we should do performance or we should give benefits. Those are important elements, but why? Why should we do those things? We do those things to help drive the organization or help make things better in the organization. We do them to retain people, to get high quality people. So making those relationships so that I can understand what is my department and my role going to do that can influence that, and having those partnerships has just been invaluable.
Oh, I believe it has been. I love that, finding the why behind, why something's important or why should we be doing something. And of course, reaching across the aisle is something I hear quite often in terms of being a successful strategy. So, in your role as the CHRO, what would you say, or what do you feel are some of your largest challenges, and how do you navigate those?
Yeah. So obviously healthcare was so challenged in COVID for so many reasons. I mean, financially, but obviously emotionally, it took a toll on everybody, but particularly in healthcare. And there's a lot of talk around burnout and violence. Workplace violence is one thing. I would say we're fortunate. We're in a little bit smaller of a community where a lot of people know each other. So some of the violence challenges, we do have some of it, but not. Sometimes I talk to my counterparts in larger urban areas who have more challenges in those spaces than we do. And ours challenges more stem around the cost of living. We're in a resort community where the cost of housing, not only is it high, but we don't have a lot of availability, and things that might be available are just out of people's price range. We've even had physicians who tend to be more highly compensated who say, I can't afford to live there. So if you think we can't
that's a challenge,
find
right?
a physician, let alone to find, right, an environmental services worker, it can be very challenging. And so that is a lot of what we focus on. Is I have an amazing partner in our organization who helps me with real estate and housing. And so our organization has done some amazing work in that space. We've also, because we're a small community, we work with all of our childcare partners to see how we might be able to support them in order to support our employees. And so there's many ways that we've had to be creative and maybe step out of kind of that traditional, what you would think an employer would manage, just to ensure the success of our organization.
Absolutely. That's interesting. Those are some unique challenges that not everyone would face, but I feel like most cities across the U.S. having some sort of, inflation of pricing and lack of inventory, but, superseded there in the mountain community, of course. That's really interesting how you develop that and you have a real estate partner to help you through all that.
Yeah, it's a little bit unusual, I would say, but our organization has had some growth, and it's just, housing is such an important piece to the puzzle.
Absolutely. And, being creative, I think, is where health systems are going to win out from a variety of perspectives. But, the market certainly is changing in a quite quick manner, from people retiring to just expectations being different about work. And of course, housing and other economic constraints. As it comes to, healthcare management and the industry at large, how do you stay informed of the latest and greatest trends and what other systems are doing, or things that people are thinking of that you might want to consider there at Vail?
Yeah. As I kind of mentioned, I do try to do a lot of networking with my counterparts at other organizations. Given that I'm a little bit newer to healthcare, my network wasn't as broad as maybe some other industries I've worked in. So, and we're also interesting because we're kind of right in the middle of the state, and we're considered rural, but we're not like the Front Range hospitals, but we're maybe not nearly as rural and small as some of the Western healthcare hospitals. So I've really tried to connect with both both sides of that, both sizes. So connecting with those smaller hospitals that are maybe more similar to us in geography and community and the challenges around recruiting and retention, but also really understanding what are those larger systems doing that maybe are a little bit more cutting edge, or they have different resourcing than we do, and really understanding what are they doing that is standing out. I also try to do a lot of reading Becker's and more healthcare related publications to keep up with understanding healthcare. And then obviously in the human resource specific field, I also do a lot of reading and looking for like the Society for Human Resources Management, anything related to talent development. I'm a huge fan of Gartner. I think they're not specific necessarily to healthcare, but they have just a lot of great research and information that I can glean a lot from them to be able to apply to our organization.
Well, that's interesting. There's certainly a lot of information out there that's useful. I myself actually do start my day with Becker's, so I can appreciate.
Yeah.
I can
I
appreciate.
didn't really know a lot about Becker's before starting to work in healthcare, but I have now since learned that it is kind of the place for all things healthcare, and you get to really see a lot of the movement in the market and really what's a regulatory environment and things like that.
You really do. It's hard. I have to kind of limit myself to, no more than 20, 30 minutes. Otherwise, there's so much content it can really pull you in all day. So, well, you certainly done a lot, throughout your career, and having a different perspective coming from hospitality into healthcare, I think is really, valuable, right? Because many of these human capital solutions are transferable over industries. But when you think back about your career, what can you share, or can you share maybe a particularly memorable moment or impactful experience that you've had?
Yeah, sure. One of my most memorable experiences is actually I had a short time in construction, which is a very different industry. It's very male dominant, which is also very different, right? Than healthcare is more female dominant. So that's kind of an interesting dynamic. But anyway, when I worked there and I first started, I had one of my employees on my team said, "Oh, that leader doesn't work with HR." And I was like, what does that mean? I've never had anybody say, I'm just not going to work with you. Okay. So I was like, well, gosh, I kind of am going to take that as a challenge for what that's going to mean. So I really took the time to get to know this leader. Once again, I got really curious. I got to know him as a person. Like, was he married? Did he have kids? What did he care about? What did he do on the weekends? How long he had been in his role. I asked to shadow him on the job site. He was a construction foreman, which meant that I had to put on my boots and my hard hat and get into it with him. And I really learned so much just about the operation, what the challenges were, what they dealt with. And as I started to build kind of this emotional capital, if you will, with him, I was then able to ask something of him. So I would say, so I hear we're hiring a bunch of people for you. I'd like for them to come to orientation. And so, of course, he's like, well, okay, we can do it at 6 a.m. because they start really early, thinking that I would say no to that. And I'm like, oh, heck no, I'm going to be there. We'll be there at 6 a.m. with donuts and coffee. But once again, just building that trust and helping him to understand the why. So fast forward throughout our time together, by the time I left the organization, he and I had partnered together. We were able to get approval for a federal apprenticeship program. This was more than 10 years ago. The program is still going on. Every once in a while, he'll send me pictures of people in the class. And he and I, we had to go take a class in order to get approved for this apprenticeship program. And really what I've learned from that is that you can have apprenticeships in any organization. And so I've been able to apply that similar concept to, if you can't hire these people, they don't exist, you're going to need to train them and build them up in your organization. So we've actually taken that concept and applied it here in healthcare. And we've been partnering with Dallas College. There's some funds out there right now through the state and through federal opportunities to be able to build apprenticeships. So we've done that here as well for sterile processing, coding, and facilities are the kind of three that we're starting with. And it's just a great concept because you take people in, you teach them what you want them to know, and then they get to grow and they get certifications.
Absolutely. That's fantastic. It sounds a really interesting way to approach, upskilling, or really, kind of helping train the workforce. We talk a lot about, succession planning and how important that
Mm-hmm.
is. And it really is going to be more
Mm-hmm.
important than ever with the number of healthcare leaders. Let's talk about nursing leadership for a moment. So,
Mm-hmm.
significant droves of them will be retiring and have already left the workforce, leaving gaps in our leadership. And so, how are we going to fulfill that? Or the physician side, even, right? 5, 10 years from
Yeah.
now, there's significant shortages that are put out there by various companies
Mm-hmm.
who estimate that.
And I also think like technology is changing
Mm-hmm.
quickly, and just even trying to upskill people who are even in their mid-career, because maybe what they learned in school or they learned earlier in their career is very different now. And it's really our job, they're great people. They're committed to our organizations, but they need to kind of keep up with the times. So it's really, I think,
Mm-hmm.
up to us to help them figure out how to do that.
Absolutely. Well, and that investment oftentimes leads to loyalty, right? Engagement, longer
Mm-hmm.
retention.
Mm-hmm.
Long ago, I wrote an article called "The Best Practices of Retention" that was in Drug Topics, a magazine, gosh, years ago now. But I had surveyed companies or hospitals specifically that had below average turnover. They were running about 4 to 5%, whereas the industry runs about 14%. And significantly, or the most significant thing that people were doing that were on that list was investing in their people, right? They're working with them,
Mm-hmm.
identifying their career paths, getting them trained, really helping them to become fulfilled as far as what they're hoping to get out of their career. And boy, that really does help through difficult times and challenges in terms of retention and turnover, and really does pay for itself
Well,
at the end of
and
the day.
it is a fundamental need as a human, that you want to be challenged, you want to learn, you want to grow. And if you get stagnant, you don't want to be pushed so far that you're distressed and overwhelmed, but you also don't want to be bored. Nobody really wants that. So it's
Right.
like that fine balance of, how do we keep you just challenged enough so that you're learning and growing and feeling fulfilled, is really that sweet spot.
Absolutely. I think that flexibility to work with people and help them move into roles that
Mm-hmm.
they would be engaged with, even though it might
Mm-hmm.
mean for the organization that they have to fill or try to find a solution for the spot they're leaving, is a challenge that, when accepted, I think is a really successful strategy. So,
Yeah.
with the shortage of people in healthcare, as we are looking and trying to pull in other people, not just from other industries, but, a lot of times as a recruiter, I'm pulling someone already doing the job from another hospital, right? But when we're looking at up and comers and trying to identify that next generation of leaders, if you will, what leadership qualities, do you think are most important for someone to be successful in the healthcare industry?
Yep. So at Vail Health, we've identified some specific leadership competencies. And the way that we identified those leadership competencies was a variety of different ways. And one of the most important things we did was we asked line level employees who report to a leader, what is most important to you? What do you want in a leader? What kind of a leader helps drive you? Because we know that study after study has been done, right? That 9 times out of 10, somebody leaves not because of pay, even though people say that always,
They
but
do,
because
but
they don't like their immediate leader,
yeah.
or they don't feel supported, or they're not growing in their position. So I truly feel if we can focus on creating great leaders and giving them the skills that they need, then the entire organization is better for it. So here at Vail Health, the leadership competencies that are most important to us are inclusion. So being inclusive, and it's not just about, the DEI kind of maybe in a traditional sense, but how do we really create a culture of belonging where people feel like they belong, they want to come to work, they feel cared for as a human. The other element is that leaders need to develop others. So they need to develop themselves. So going back to that growth, you need to constantly be looking at what's important to you, how can you grow we can always become better leaders, but also how do you help develop your team and meet them where they are in what they need. Emotional intelligence is extremely important. So maybe sometimes considered a softer skill, and maybe more about how you do your work than what you do. But it's really important to be able to, we're working with so many different types of people. And especially like you were saying with the healthcare industry, we have a lot of people who are retiring. Therefore, we also have a lot of new grads who are coming in, and they're coming from a very different perspective, right? They don't have as much experience. And so they probably need more directive. And that's kind of that emotional intelligence of knowing, like, when does somebody need more direction versus more support, and knowing really, I think, how to meet them there. So inclusion, development, emotional intelligence, accountability, doing what you say you're going to do, making sure that, you follow through, you build that trust. And then finally, I think strategic thinking is extremely important in this day and age where things are moving quickly and regulatory changes are happening. You need to be thinking strategically about what is the impact to our organization and how are we going to adapt to remain sustainable.
Yeah, that's interesting. I love the ideas that you shared there. So many of the people I talk with, really, when we're recruiting for them, they kind of give us a JD or a list, right? Here's what the
Right.
person needs to do, and that's great because they need to do that. They need to have the experience, the education, right, to lead that unit forward or that hospital forward or whatever the role might be. But realistically, what we're looking for is the soft skills, right? It's the fit. It's the do they fit into the culture? Do they have the right mentality? How do they make decisions? And does that fit in well with your team? And are they agile, right? Which is so important. I love that you guys focus on those areas, and it's no wonder why you had such great success at Vail Health in not only hiring but in growing and increasing services to a challenging marketplace. In the face of headwinds that are significant. So it's really a testament to those soft skills and how having the right group of people put together can overcome challenges. It's not just the what, it's the who.
Definitely. Well, and I think when you're clear on what matters to you in leadership, you can interview with that lens in mind, and to your point about getting a fit, and you can also develop around that. So, somebody can be an incredibly high performer in delivering results, and nobody on their team likes them because they're not nice, and so you can use some of that to say, okay, your emotional intelligence needs some work, and here's why that matters. And I think it's just helpful to have that common language for sure.
Absolutely. And we see it all the time, right? Sometimes I think people that are high performers are kind of known to be difficult. I think we tease about that with physicians occasionally, not that we would ever tease about a physician, but, it's so challenging healthcare, right? There's so many different angles, components to what's happening from a, economic perspective, the population health perspective, as far as what are the needs of our community and how do we deliver, quality care to them in an affordable way that meets them where they are, combined with regulatory pressures and right? We know that there's significant. So with so many pressures, coming at us or at you in this role, how is it that you guys, or you specifically, how do you prioritize, making decisions? How is that, how do you think about that and break it down?
Yeah, sometimes it's hard. I will tell you from a day-to-day basis, and there are so many changes coming. What I always try to anchor to, though, is what is our organizational strategy and what are our organizational priorities. And so when my team comes to me with an idea, or we have an idea among our leadership team, it's really critical that we go back and say, okay, how would that line of work, or how that new service line that we're interested in, how does that support our mission of the organization, and how does it align with our organizational strategy and priorities? Because oftentimes it seems like a great idea because somebody sold you on it or somebody mentioned it that they needed it, but it doesn't always necessarily fit in. And so really just taking the time to think through, how does that fit in? And I think an area of opportunity is, especially for some of our leaders, is to figure out, how do you build a business case? So how do you take an idea where you say, yes, I think it's aligned to our strategy, but is it going to make money? Is it going to lose money? Maybe it's okay if it loses money as long as it's serving our part of our mission. Thinking about all the parts and pieces. And like I said in the beginning, using your partners to help you think through that, to say, is this really a viable option? Is this a really good idea? Sometimes I think we need to go slow to go fast. And in this day and age, sometimes it's easy to go fast because you're like, everything's coming at you and you're like, I just have to decide and figure it out. And I think part of being a good leader is actually knowing when to go, I have to take a breath. I'm going to slow down. And even just pausing just for that little bit sometimes can give you the space you need to know, like, am I focused on the right things? Am I focused on the things I should be focused on, and prioritizing that? And sometimes you just need to check in with other people to say, here's how I prioritize. I do this with my CEO one-on-one. I often will say, okay, here's where I'm focused. Tell me if I'm off base, because he may have a different opinion than what I do, right?
I do that with my clients too, actually. This is where I'm going.
Yeah.
Yeah, that check-in's
Yeah.
important. I love that idea
Mhm.
of taking a pause. There's a book I think it's called Thinking Fast and Slow, if I recall,
Uh-huh.
that talks about that actually, and the importance of there is
Mhm.
a time to think fast, and there's also a time to slow down, and
Mhm.
how really important it can be to take that breath. So as you guys have of course thought about all the things that we could do, all the things that you can do in terms of services, service lines, procedures, care, etc. One thing that you guys have made a decision on and started making a headway on is this workforce well-being project. Can
Mhm.
you tell us a little bit
Mhm.
about what that's all about and how that aligns with your goals?
Yep. So, I would say coming out of the pandemic, we definitely, as many healthcare organizations, we had a higher percentage of travelers than we had historically, and more than we wanted to, which not only was very expensive, but can be really challenging to a culture when you only have people here for 13 weeks and you're having people come in and out. It's hard for them to always get assimilated and feel that sense of belonging to the team. So that was one, I guess, challenge that we had. So just kind of inherently, how do we stabilize the workforce, not only for financial reasons, but also just for cultural reasons. And one of the areas that we decided that we just really needed to focus on for that retention and to reduce that our vacancy was to focus on well-being. I fundamentally believe if you care about people and you truly care, that's really what we all want. And everybody brings their whole self to work, and our whole selves sometimes need different things on different days. So part of our well-being focus, right, has been, a lot of times when you talk about well-being, people are like, oh, physical health, are you getting enough exercise? Okay, well, that's important. So we have a gym on site at two of our different locations. That's great. What about emotional and mental health? We have what we call a Zen Den at each of our locations as well. It's a small room that has a massage chair, aromatherapy, has a like a yoga mat, so enough space if you wanted to kind of stretch out. And there we block them in like 15 to 20-minute blocks, and it's literally meant to be a space, a safe space where employees can come and get out of and decompress. We also have implemented $1,000 well-being credit. So a lot of people in our area are passionate about skiing, and ski passes are not necessarily cheap. So it kind of came out of, I want to get a ski pass, but you recognize that people have all sorts of different things that they might want to use. Somebody might want to buy running shoes. Somebody might need to get a massage. So there's all different types of things that people can use that $1,000 for, and they get it annually. So that's been very, very popular. And I think some of the other pieces of well-being are financial stability, your social and emotional well-being. So we've created like run clubs and bike clubs and just opportunities for people to connect. Once again, in our area, oftentimes people move here from elsewhere. So maybe they don't have a built-in network or family. And so it's really important for us to help facilitate people creating friends and finding people who have similar interests to them. So that is just another example. And it's not any one of these things is transformational. It's all of the things together and people choosing what really they need and what's most important for them and their families. That's what I think promotes this culture of well-being. I was just going to mention one more thing that I think is really important is that, as in particular with our physicians and our advanced practice providers, what we hear time and time again from them is just their burnout around documentation. And they're seeing patients all day, and then they're spending half of their night, till midnight trying to document and follow up and all those things. And so we've been really looking at what are some other technologies that we can be using for them to help with that documentation, to help reduce their burden and therefore really their burnout.
Yeah, that's wonderful to address that. It's a significant issue, right? I think we all read about it,
Mm-hmm.
not only in Becker's,
Mm-hmm.
but in lots of different publications. I love
Mm-hmm.
how you guys are approaching people from that 360-degree view, right? It's not
Mm-hmm.
just mental, physical, it's, financial, it's, do we have a support network? Because so many people do relocate for roles. Oftentimes they do not have a built-in support network handy, and it is easy to fall into bad habits or to feel maybe disengaged or a little lonely, right? When you run
Mm-hmm.
into
Mm-hmm.
challenges. And I think that's a testament to creating a good culture, one that people can not only want to be a part of, but get satisfaction from being a part of. I mean, I gotta say, the idea of having like a Zen room with some yoga is pretty nice. I might just have to see if we can get one of those around our office. But
Yeah,
um,
yeah, exactly. Well, and it really stemmed from kind of the pandemic, where the work was in particularly intensive, and we have a well-being committee. So this is not also the work is not driven by HR. It's really driven by a variety of different leaders from all different spaces. We have two clinical leaders in particular who are passionate about it, and they lead a group of people from all over the organization. And then my team kind of is one of my team members sits on that committee and says, here's what we can do holistically as a system and where we might be able to provide some funding to those ideas. So I think that's one reason it's really successful. It's really driven by the people who are doing the work day in and day out.
That's wonderful. Well, and getting people's engagement really does help drive success typically. And of course, what's important to them? It's just a simple question that we all should be
Exactly.
asking ourselves for our employees and how we best take care of them. So, well, Jen, thank you so much. It's been a pleasure having you as a guest on the podcast today. I know people have gotten some, great tips about, what they can do as they aspire to, advance their career, but also things that they can do to help improve the culture and retention at their own facilities. And so I certainly appreciate your time and thank you for being a guest on Advancing Leadership Beyond the Bedside. It's really been wonderful speaking with you today.
It's my pleasure. Thanks, Mike.